The following dramatization presents two ill-structured scenarios. It's not intended to model, but rather to promote critical reflection and group discussion on the challenges associated with discussing bad news. In this scene, a family physician is visiting his patient after he has had surgery for colon cancer. It's not looking good for John, however. The surgeon also found metastases on the fatty tissues around the bowel and the lining of the abdominal cavity. As you watch the segment, consider the following questions. What is happening? What issues does it raise? What emotions come to your awareness? What implications does it have for how we practice?
I'm about to visit John Philpott. He's recovering from surgery. He had a bowel tumor removed and evidence of metastases. This means that John's cancer is incurable. Now, I know the surgeon has talked with John, but I don't know if John really understands his condition.
I'm feeling pretty good. Yeah, I've got some pain, but the surgeon got my tumor. It was attached to my bowel. But the most important thing is that the tumor is gone. I'll probably be out of here in a few days, once they can remove these tubes and get me on some decent food. I'm sure everything's going to be okay. No biggie, as my son says.
Hi, John.
Hello, Dr. Rupert.
I was sorry to hear the news. We were hoping that surgery and a course of chemo would cure this tumor.
What do you mean?
When a tumor spreads through the abdomen, like yours has, there's a limited amount we can do for you.
What do you mean spreads through the abdomen like mine has? The surgeon said he'd removed the tumor.
Yes, the primary one, but he couldn't get all the places it had invaded. We need to give you chemo for that.
What do you mean invaded? You keep talking about this chemo stuff.
Didn't the surgeon talk with you?
Yeah, but he didn't say anything about chemo or invasive stuff. What the hell is going on here? I thought I was cured. Now it sounds like I'm not.
I'm sorry, John. I thought you knew.
Well, I didn't. I don't believe it. They've shown you the wrong chart. I'm going to be fine. Just need a little medicine and I'll be right as rain.
Okay, John, I'll be back later.
Now, let's review the scenario again. Consider the following questions as you watch. What is happening? What issues does it raise? What emotions come to your awareness? What implications does it have for how we practice?
Hello, John.
Hello, Dr. Rupert.
So, how are you feeling today?
I hurt some. But I guess that's what you get when you let someone go poking around in your belly. But I gotta say, the nurses have been great.
Do you have enough medication to control the pain?
Oh, no, I'm just fine. Mostly I just want to get these tubes out of me so I can go home.
The surgeons talk with you?
Yep, and another doctor, Oncolo, something or other.
Oncologist?
Yep, that's it.
Do you want to tell me what you understand about your illness to this point, just so I know we're both on the same page?
Yeah, sure. They said they had removed a tumor from my bowel, but I might need some chemotherapy. That drug stuff worries me a little, though.
Do you know why you need the chemo?
Yeah, it's something about cleaning up the cancer after surgery.
And what do you understand about the future?
Even though I'm scared of the chemotherapy drugs, I'm sure that they'll cure me. No worries.
Did the surgeon tell you what he found?
Yeah, some invasion of the fatty tissues and covering the bowel.
And what did he tell you about that invasion?
Well, he said that it wasn't good news.
John, how are you feeling about all this?
Scared.
Anything I can explain to you?
Actually, the oncologist has told me everything that I want to know at the moment.
Okay, we're all here for you, John. And if you need to talk to me or anyone, just let the nurses know.
Thanks, Dr. Rupert. I'm glad you could drop by.
I'll see you again in a couple of days, okay?
This scenario illustrates that a family physician, nurse, or other member of the care team is often involved with a patient after they have had information from other providers. Presuming a patient has the same understanding of the illness as the care provider can be very destructive. Asking a patient for their understanding of the illness is key to communicating about bad news and helps guide the necessary conversations. It can be helpful to literally and physically sit down with the patient to discuss concerns of this nature. Asking about patients' feelings and underlying interests can make them feel supported and cared for. It encourages them to express feelings in the future because the care provider has considered them important enough to ask about.